Hello and welcome. This is Beyond the Darkness. I'm your host, Dave Schrader. Along with me, that guy, Tim Dennis. How you feeling, Tim?
Oh, not too shabby.
How do we know? How do we know?
Well, we don't.
You pre-recorded this, Tim. You're not even here live right now.
That's true.
This is some kind of weird interdimensional time rift we're talking through.
It is, yeah.
You've had surgery on your foot.
I have.
Okay, prediction? Everything all right?
I predict, yes. Everything is going swimmingly.
I hope so.
Yeah. And I'm seeing pink elephants on the ceiling.
Keep Tim in your thoughts and prayers, folks. He's in the hospital laid up with a bum leg right now. We pre-recorded the show a little bit earlier this week as he has had surgery and will be out of the loop for a couple of days here. And meanwhile, I'll be out at the Palmer House Hotel doing our big paranormal event.
There you go.
Without you, because you're too busy being all laid up and junk.
Well, I could,
That was well thought out. That was well thought out.
You could hobble up there if you'd like.
No, you probably shouldn't.
I could,
No, probably shouldn't.
get on my scooter and...
Let's get into tonight's show. Tomorrow night, Bill Burns is here. We've been talking about it all week. The 75th anniversary of the Battle of L.A. War of the Worlds, Tim. Aliens. That's what's coming our way. Plus an amazing theater of the mind.
I feel like there should be a truck pull in there somewhere, too.
Should there?
Yeah.
Friday.
Yeah, there you go.
The War of the Worlds truck pull.
Yeah.
Brought to you by Rougarou. That's Australian for beer.
Exactly.
Yeah.
There you go.
Speaking of Australian, Tim, we're going to go down under for this next segment this evening. Down under.
Oh.
Mm-hmm. That's what I said. Pay attention.
All right.
Chelle Taylor is our guest this evening, is a registered clinical psychologist with over 20 years experience working in government departments and community service organizations in the remote, rural, and regional centers in Western Australia and Victoria. Chelle's expertise is in the neurodevelopmental assessment and treatment of children who have experienced attachment disruption and trauma. Chelle has now and for the past 2.5 years has run her own private practice in rural Australia and spends what little spare time she has investigating the paranormal along with her husband and their team, Western District Paranormal. And over 20 years working clinically, Chelle has worked with children who've talked about their paranormal experiences, such as seeing ghosts. And since she came out about her interest in the paranormal, Chelle has been consulted by other child psychologists in relation to her thoughts about their own clients' disclosures of paranormal experiences. Children of the paranormal, that's our topic tonight on Beyond the Darkness. Chelle, welcome to the show. Thank you for joining us today.
Thanks very much for having me, Dave and Tim. It's great to be able to hook up and have a conversation with you guys about this.
I want to talk about the psychology of the paranormal and start off with that. A lot of people can have what is perceived paranormal experiences when it's really nothing more than just the way the brain and the heart might work through grieving process or work through stress. When you're talking to clients, as a clinical psychologist who believe that they're having supernatural episodes, what do you really look at to try to discern between paranormal and just the normal function of the brain and how it works when things are misfiring?
That's a really good question, Dave. Look, and I think first and foremost, to be very clear, I haven't done any study in parapsychology. In Australia, parapsychologists don't get the registration recognition that I think they do in the United States. So I plan to do some study in that at some point, but it's about finding the time. But in regards to your question, the thing is you're constantly undertaking a really thorough assessment. You're using your well-grounded mental health assessment skills, and you're looking at, we're well trained in diagnosis and what are the key features of different mental health conditions. So you're looking for the symptomology of that. Very much when I'm assessing children, I'm looking for, is there, how in touch with reality are they? Have they, and I'm trying to think of examples off the top of my head, how in touch with reality are they? How coherent is their story? All of those sorts of things that would lend to more mental health concerns. A lot of kids that I see have experienced quite significant trauma, and a lot of that trauma has been in the relational realm. So for a lot of the kids I work with, they're involved with child protection services, and they've been removed from their families or removed from their homes, or the people that are supposed to care most for them have hurt them quite significantly. And so they've had quite significant trauma as a result of that, and trauma in the context of relationships. So people aren't safe and the world isn't safe around them. And what I find is that a lot of the children I work with talk about the experience of seeing ghosts or, apparitions. And a lot of those are largely focused around people they know, people that they were close to. So it might be a dead relative, a dead grandparent, somebody who previously had held a close relational role in that child's life. And I'm a big one for thinking that for these children, that's largely a big source of comfort as they go through this incredibly tumultuous time. The other thing that's really worth keeping in mind is people who experience traumatic experiences. It's not uncommon, given the considerable emotional upheaval that occurs during a trauma, for those individuals for a sporadic period of time to experience hallucinatory and delusional-based phenomenon. That doesn't mean that they have a discrete mental health issue, but for a period of time they might report hearing voices, seeing things. And so we've got to be really careful to kind of assess that adequately and appropriately. I'm a big one, and part of why I've kind of started to really speak out in the paranormal field with my, psychology knowledge, which I have a bit of, and I have a tiny little bit of paranormal knowledge. That's not great, and I'll be the first to admit that. I've got a long way to go in kind of expanding my understanding of the paranormal world. But, I'm very, very, I'm constantly saying to teens here in Australia, you need to be really cautious about jumping straight on the paranormal bandwagon. And at the same time, you equally need to be cautious about jumping on the mental health bandwagon. And if you're not sure, you really need to be seeking the advice of, somebody with some experience in the field, or, and consulting with them to get, and maybe even referring those people across to appropriate services for that assessment to determine whether or not we've got a mental health issue, or if we actually, there might be some paranormal or unexplained stuff left over.
Do you find in people that have claims to the paranormal, especially younger people, younger children, when they're making these claims, are they coming at it from a dysfunctional family? And I know this might seem like a tough question because you're a clinical psychologist and your job is to talk to children that obviously have some kind of messed up thing going on in their life at this point, and they're seeking answers, right?
Yeah.
But, trying to make sense of what they're dealing with in this heightened, stressful situation, and talking to them about these paranormal experiences. Do you see that there are different levels of experiences people have depending on the level of dysfunctionality in their life?
Given the few that I've seen, I would say yes, but again, it's a very small clinical sample. So, I would want to see a lot more over a longer period of time to confidently say, yes, absolutely, Dave, that's it. But look, everything I've consulted on, I provide some consultation services to investigation teams, and there hasn't been a case yet where the kids who are reporting paranormal phenomena, that there isn't some sort of dysfunctional family dynamic going on. And it's really interesting. The more dysfunctional the family gets, it seems the more, particularly in one of the cases, the more dysfunctional the family became, and the more likely they were facing a complete family breakdown, the more exaggerated that child's claims of the paranormal became. And what we worked out was, for that child, when she talked about the paranormal, she got a reaction. She got a reaction from her family. They got anxious. They got scared. Everyone rallied around her. And all of a sudden, the dysfunction in the family was forgotten, and we could focus on this problem. So when we unearthed that and we started to talk about, well, hang on, what have we got going on in the family? Maybe this is a cry for help. And we looked at how, a lot of what she was reporting was very accessible in the media, and it was around the Halloween period. So all of a sudden it grew into Halloween-based themes. And we were able to kind of resolve that for that family by putting them into appropriate services as opposed to staying invested necessarily in constantly providing attention. In addition to that, though, we did things like, they had the house cleansed. We, provided her with, protection symbols. So she got a necklace and some crystals, and the investigators working with her also did some work with her around mantras and protective things that she could say around, leave me alone, go away. So we didn't discount and we didn't minimise or dismiss the experience of the paranormal for the child, but what we absolutely did was we looked at, well, hang on a second, there's some really significant dysfunction going on here, and this serves a purpose for this kid. For some of the other children I see who have been significantly abused, absolutely, I think you do get more of that gravitating to fantasy and magical thinking as a way of coping with the horrific experiences that they have to face every day that you or I wouldn't even dream of having to deal with.
What do we know, Chelle, about children and the paranormal at this point? I mean, from your perspective.
Okay. So from my perspective, and there's probably a lot of literature out there I haven't been able to get my hands on, but what I know is, I believe that children probably do experience things that are in the paranormal realm. We all experience things that are unexplained. There's no doubt about that. What we know, though, what I can find that what we know, and the big theory that sits out there, when you kind of look at children and the paranormal, the biggest theory that I see is that a lot of children tend to stop talking about their paranormal experiences at around the ages of 6 to 8 years of age. So there was a retrospective study done of over 3,000 adults by Breen in 2011, and she found that for those who reported paranormal encounters, at least 1 in 10 occurred before the ages of 6, but that there was a marked drop-off after the ages of 6 to 8 in young people reporting or continuing to report paranormal experiences. And the big theory that people have around that is that we condition it out of them. Go back to sleep, there's nothing under your bed. That's just your imagination. Don't be silly. That was nothing. That was just the house settling. That was just the wind banging on the window. Or you didn't see anything. You're just silly. And when we say that to children often enough, the belief is that we squash that or we inhibit their willingness to talk about their experiences of the paranormal. I think there's a neurodevelopmental spin to that, though.
Well, let me ask you about that. Why do we believe that children can see and experience the paranormal so much more readily? I mean, why is it accessible for them and not for us as adults? Aside from the idea that, we're told it's silly and it doesn't exist and we kind of shut that down, is there something that we know about the psychology of the brain at an earlier age that would allow for us to experience this and witness it more readily?
I think so. I really do think so. One of the modern advances that's happened in trauma and attachment treatment has been a real increased knowledge of neuroscience and the way the brain organises and develops. So if you strap yourself in, we'll go for a little bit of a science lesson, and I'll take you a little bit through how the brain organises and why I think children under the ages of 6 particularly, or particularly under the ages of 4, are much more prone to paranormal experiences, and also why we then maybe stop reporting them or we become less open to paranormal experiences. So the brain is quite a dynamic organ. That it controls everything that we do. It's our absolute command centre, and it starts organising from the moment of conception. And the brain organises from the bottom up. So our brain has a multitude of parts, and I'm going to significantly simplify this and talk about the brain as having 4 main parts. So we have a bottom part of our brain, which is our brainstem, and that organises while we're in utero. So while we're incubating in mum's tummy, our brainstem is all of the neural associations that will help our brainstem control our blood pressure, our heart rate, and our temperature are being organised. So So when we're born, 90% of the brainstem is organised. 90% of those neural connections are already made. The next part of the brain then to organise after birth is the diencephalon, and that controls our sensory perception, our sensory processing, our movement, and our rhythmic cycles, sleep, wake, hunger, waste disposal, things like that, and movement. So the diencephalon is largely being organised between in that first year of life, or first 2 years of life. So what that means is that in those first 2 years of life, we are incredibly sensory beings, and we remain that way until our cortex comes online. But before our cortex organises, our limbic system does. And our limbic system is the part of the brain that is all about emotions and feelings and social relationships. And that's largely being organised between 1 and 4 years. So so then after that's organised, our cortex, which is our thinking part of our brain, the clever, the smart part, the problem-solving part, the part that allows us to wonder, the part that allows us to think abstractly as we got older, that really starts to organise at the time we're going to school. So, sort of 4, 5, 6, but, largely in the 5, 6 realm. And it continues to organise for a little bit. So my thinking is that for the first 6 years of life, largely our children are incredibly sensory beings. They experience the world through their senses. And so therefore I think they're far more open to sensory-based perception, and therefore more open to what might be going on in the paranormal realm. When that thinking brain comes online, however, what we have is the ability to kind of then think and question. And so as that develops and as that becomes stronger and more organised and more able to kind of challenge our thinking and think about the world, we then ourselves can go, well, hang on, what was that noise? Oh, no, that was just whatever. And so we can talk ourselves out of it at that point as well. So that's one factor as to why children, I think, are more sensorily perceptive to paranormal experiences at a young age. Then there's another, in the same neurodevelopmental thinking, there's another theory around that kind of conditioning, which would sit alongside that, kind of turning 6 and getting your cortex happening. And that's the concept of use dependence. So our neurons make connections, and our neural connections form in our brain through patterned repetitive experience. So if you grow up in a home where it is openly spoken about, your mum's a medium, your dad's an investigator, and at the dinner table, the paranormal stuff is openly talked about, psychic experiences are openly talked about, you are going to develop neural connections that say, this is okay, this is real, my experiences are real, what I have is validated, and that will continue to be strengthened, and those belief systems will continue to hold through into adulthood. However, a little bit like the conditioning theory, and that's essentially what the conditioning theory is at a neurodevelopmental level, if you're constantly told, don't be silly, that's just this, don't be silly, that's, your imagination, go back to bed, go back to sleep, there's nothing under your bed, there's no such thing as monsters, all of that sort of stuff, then what you get is you get this use-dependent change in your neurons, or a use-dependent organisation of the neurons that says, my paranormal experiences aren't real, this is silly, this is my imagination, and then that becomes the belief system you hold into adulthood.
I can see that to a degree, but I would assume that, that's like saying, listen, I don't believe water gets me wet. I just don't believe it. I don't think water's going to get me wet. I'm not going to believe it, blah, 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 blah. And you walk out into the rain and you get wet. Just because your belief system doesn't allow for the concept of you getting wet doesn't mean you're not going to get wet when you walk out into the rain. So if the paranormal is on and around us at all times, whether we believe it's existing or not, shouldn't we still be experiencing it?
I think we still experience it, but what we do is we have a tendency to explain it away, justify it, or we then, like I grew up in a family where it was don't be silly, that you've got such an overactive imagination, Michelle, and yet here I am in adulthood traipsing around in the dark at nighttime looking for shadows and wondering why my hair is being pulled off my shoulder at Waverly Hills Sanatorium, and looking around and finding nobody else who could have even touched my hair and moved it off my shoulder, and then not being a breath of wind to have moved it. So, yeah, of course, I think you can – it's about how you then use your belief systems and how much you invest in them as you get older and how entrenched they become. And, do you explain away the experience you have, or do you then go, well, you know what, hang on a second, I can't explain that. I want to know more.
When you are talking to these children and they're opening up to you regarding their experiences, can you tell us what kind of experiences do they share? Is it a common thread in these stories, or is each one an individually different type of story?
Dave, there's a real common thread for the kids that I see. And the large one of that is seeing ghosts. Like, that's what they report. I saw there's a ghost in my room. And invariably, once I question about the ghost, some of my colleagues would automatically jump on the band of delusions and hallucinations. And that concerns me, because when you start to question these children, they talk about that ghost figure, or that, what it is they're seeing, as being somebody that they love. Like I said before, somebody that they've had a strong relational connection with, who has passed away. And that has very much been the common thread that I've heard. And they're the ones that I've really stuck with and kind of believed. And, whether it's magical thinking, whether it's fantasy, whether or not there really is the presence of a safe, protective relative that has come back at a time of trauma to support these children through a really, really, really difficult patch. I don't know the answer to that, but what I do know is that these kids are having an experience that affords them comfort, and it affords them reassurance. And in no way, as a psychologist, am I going to do anything to challenge or take that away from them.
Has there been any kind of neurological issues with these children that you've noticed, so that we can pinpoint, hey, there's a form of epilepsy this child is working with, and this one did as well? Is there any common thread like that you see?
Not in the children that I see, no. No, they've been pretty well intact kids. They might have had long-standing trauma and attachment disruption, and that has resulted in sensitivity in their response to stress. So what I mean by that is we know how I was talking before about the way the brain organises up through all those parts. If you experience trauma or attachment disruption at different developmental stages, the way in which your brain wires will be impacted. So you can then get changes in brain wiring. But what we know neurodevelopmentally is that most of those changes occur in the stress response system. So the stress response system is the fight, flight, freeze response. And so that's if you're presented with a threat, you'll either fight the threat, you'll look it around and go, can I fight my way out of this? You'll flee, or you'll freeze. And what we find with these children is that they become overreactive to threat. Now, our brain is a paranoid organ, so it perceives anything novel as threatening. And so you think about it. You go into a new environment and you're going to be a little bit anxious. But that's your stress response system saying, just keep yourself on guard. You need to be ready. You just don't know what's going to happen. Whereas for these kids, they have an incredibly heightened stress response and they become incredibly reactive. So neurodevelopmentally, that would be the only thing in the kids that I see. Kids that have neurodevelopmental disorders, I don't see a lot of. My specialty is very much around that, children who come up through the CPS system, Child Protective Services system, and children who've had significantly disruptive and abusive relationships. How do you start to support children like this that are telling you, I'm having these experiences? How do we support the experience without shutting it down, but also not enabling them to feel like, oh, if you tell me these fantastic stories, you'll get my attention? Do you understand where I'm going with that question? Not rewarding them just for the attentive reasons that they're giving us, for creating stories. Yeah, that's a great question. And look, this is the stuff that I do with some of the teams here in Australia is I say to them, when you're working with kids, always ask open-ended questions. Never tell me, open-ended questions are just tell me what it looked like. How did that feel? What was that like for you? Never be suggestive. So don't lead them up the garden path. Was he wearing a hat? Could you see through him? Was he black? All of those things are going to give the kids, so much to work with because, they're going, they're invested. I've got them. I've got them on a hook. The thing is to always remain bigger, calmer, wiser, kinder and stronger within yourself. So that means you need to be grounded as an adult. You need to be calm. You don't need to, it's incredibly unhelpful for these kids to see a significant anxious reaction or an overexcited reaction about what they're talking about, rather more one of calm, grounded concern. So, and when I say concern, I'm not saying, oh, my God, that must be awful for you. What I'm talking about is tell me some more about that. What was that like for you? Were you scared? Tell me what the feelings were that happened when you saw that. And then you just kind of finding out what the function is that that what they're seeing serves, working with their beliefs, but not over exaggerating it any more than necessary. And then what I look and do is, I put in a variety of other supports around these kids. So, it might be that you're just looking at who's one person in their life that's alive and can provide a function of safety and support and security, and will take the time to build a relationship with this child to, make them feel that way. And invariably what we've seen as we've done that is a marked reduction in the reports of visits from their deceased family members or relatives.
All right, our guest, Chelle Taylor, we're talking about children of the paranormal.
Beyond the darkness.
This is Beyond the Darkness, and tonight we're taking a look at a very important aspect of this. As the father of 7, myself, and a handful of those kids, Tim, they like the paranormal. They're intrigued by the paranormal. They want to know more. I've taken them on a couple of local ghost hunts, and they are intrigued by it. They're kind of scared by it, but it's like a thrilling excitement.
Right.
But I'm very cautious with how I expose them to that, and I show them how to do the right thing. I want them to not be afraid. I want them to have respect for what we do and respect for the situations they put themselves in and respect for the spirit realm. Because if it's out there and we're dabbling in it, we should understand what we're doing and be respectful of it.
Right.
And my kids are getting better at that and excited by the prospect and seeing things, witnessing things for themselves. And we're talking with Chelle Taylor tonight. She is a registered clinical psychologist with over 20 years experience, and she works with children. And some of these children have had their own paranormal experiences. So we've been discussing with her dealing with the paranormal in children's lives and what we can do to enable them, strengthen them, and educate them. We've talked about kids that seem to just be talking about visitations from loved ones or family. And as you said, that might be a coping mechanism for them to, get through the harsh reality that they're dealing with, Chelle. But what about kids that are having these experiences and are frightened by the paranormal?
Yeah, absolutely. And I think we have to be really mindful of how we work with families who have got children who are reporting paranormal experiences and are afraid. I remember when I was little and most kids at different developmental ages, particularly in that range of 4, will be afraid of monsters and things coming out of their cupboard or under their bed. I know when, even as an adult, when we go investigating, sometimes I have that, it's that real fine line between thrill and fear as we go into an environment. And And I think about what that might be like for a child who is seeing something or who is experiencing something, or maybe who has psychic abilities and is frightened by their capacities or their capabilities. And so I think what we need to do is we need to be incredibly reassuring. There's so many dangers in being dismissive of these children, and I know Chip Coffey and the Paranormal Kids, Psychic Kids TV show that was on in the United States, talked extensively about this in terms of, being very cautious not to dismiss and minimise children. I remember watching one of those episodes where a mum was incredibly dismissive of her son's experiences and abilities, and he became increasingly withdrawn. There was significant family discord as a result of that. And for these kids, if we don't, it's like anything. When I'm working with children, when I'm working with anybody, I'm working from their belief system. It's not my job to determine whether it's accurate or not. Sometimes it's about, this is what their reality is, and I need to work within that reality, determine whether or not this is helpful for them or if this is going to cause them problems. Because if I don't, then, I run the risk of these children thinking that they are crazy. I run the risk of increasing social withdrawal. And from that, then we get depression, anxiety, anger, social isolation. If these children come out about their abilities at school, they can be bullied and teased. Then we get self-doubt, we get low self-esteem, all of these. And these are all mental health issues that we have to be mindful of and that we have to support these children through. Just because they have these capacities and this sense of their own reality or their experience of the paranormal world, we need to be mindful that we don't inhibit that in such a way that we create more problems for these children than necessary, or that we actually steer them on a path to long-standing mental health issues.
So, well, how does questioning it open them up to mental health issues? I mean, if we're not predisposed to it, how is dismissing or things like that, how does that create a mental health disturbance?
Well, what you get is you get children then starting to think, well, if you are predisposed to it, if you do have abilities, like say for instance, you've got a child who's very sensorily perceptive and can touch in with, psychic phenomena or unexplained phenomena, and we dismiss that, but they absolutely believe it to be real, then we can lead to that self-doubt, that self-questioning. And it happens in, we see it happen in relationships where, if one partner tells another partner often enough that it's their fault or, they're constantly blamed and they're constantly belittled, then they start to believe that about themselves. You can erode a person's self-esteem very easily with constant dismissal, constant, ridicule, and putting down of belief systems. So I think we have to be really cautious about that. So it is about allowing an openness of discussion so that these children don't start to think I'm crazy. Because what then happens is and if they go to school and they talk about it and they get picked on or teased or, can you tell me what's going to happen on Friday and these kids then, they shut down and they move away from the social network. And what we know is that we need relationships to survive. It's relationships that keep the world afloat. It's relationships that heal. It's relationships that make us survive as humanity, and healthy relationships. And, when kids withdraw, they're not getting the social resources and social support that they need to, make themselves feel good about themselves. So they get into this downward spiral that then creates mood disorders, like depression and anxiety. So, I think it's a really fine line. You've got to be really careful about what you're doing. We have, over here in Australia, I don't know if you guys have it in the States, but we have, we have teams who go off and do, some mental health training. And some of those teams are very respectful of the training they get. That training doesn't make them mental health practitioners. It doesn't make them able to diagnose, but it makes them able to identify kind of features of mental health issues. And the ones that respect that training and stay within the limits of their competence will generally, steer families to the direction of appropriate services to get support for children around, what sort of mood issues or behavioural issues that might have emerged as a result of their paranormal experiences. But we also have others who, go off and do these things and are much less respectful of what they've been taught and, see it as a way to, I've now got skills to intervene and that really concerns me. I don't know if you have that in the United States, but that really concerns me that we have, moderately untrained people engaging in, explanations and, I would hope they're not out there doing pseudo-diagnosis, but we had a case recently in Queensland where, a guy was absolutely convinced that the child was demonically possessed. And this was published in the blooming newspaper here. Convinced the child was demonically possessed and they'd done some training and that they were going to be able to exorcise this demonic possession from the child. And, they were able to see red hand welts on the child. And it turned out that the child was being abused in their family and, Child Protection Services came along and removed the child. And, the child got the appropriate mental health support services that they needed. But, that sort of stuff really worries me. You can have a little bit of information, but it's about knowing the limits of your competence around that and making sure that you use appropriate support services to help these families properly. Our children are our future. They're little people. They're not just these beings that are nothing until they become adults. They're little people, and it's our job to grow them up. It's our job to protect them. It's our job to guide them appropriately. Dave, when you were talking before about your kids and how you expose them, I know and I'm confident that you have thought about, when is the right age to start doing that with my kids? When, what can they tolerate? What can they take? What's too much? What's not enough? And as a parent, you do that, and you're mindful and you're respectful and you're thoughtful around that, because that's your job. That's your job as a parent, and your children, and that's what concerns me. Investigators are going into private homes and they're doing investigations with people that they don't know from a bar of soap, and they're making massive statements about what's going on. With little knowledge around possible mental health issues, little knowledge about possible family dysfunction. Families can be very good at masking dysfunction, and things like, and I'm a skeptical. I'm skeptic, but I've had my own experiences that I can't explain, and I know I've talked to you about them in the past, and. So I sit on the fence, but at the same time I kind of go, well, until I know that there's nothing else, then I'll just, I need to rule everything else out before I'm going to say that this is unexplained. And sometimes families can, hook onto something like paranormal as a way to deviate your attention from what's really going on. But the thing I worry about is, how do we keep these kids safe? How do we make sure, if they are having paranormal experiences, how do we validate them in that? How do we support them?
When they're dealing with these scary moments and things like shadow people, a lot of children I've encountered deal with the shadow people. How do we empower them to deal with the paranormal, face it, respect it, and not show into fear? I mean, our natural inclination when we see things we don't understand is to be afraid of it. And, I want to empower my kids, and I try to take away that fear. But as I said earlier, I want them to have a healthy respect for what we're doing so that they don't run headlong into stupid situations. If you know there are snakes in a cave, you're not going to send your kids into the cave unprotected. You're going to teach them healthy respect and fear of snakes so that when they encounter one, they know how to deal with it. And the paranormal is kind of that same realm to me. It feels like all kids should have some kind of understanding of this, but that's where it gets tough. When is the right age? For my family, they're immersed in it because of who I am. So my kids started at an earlier age, and I've made it matter of fact. I don't make it a scary situation. Doesn't mean I don't spook them from time to time, like all parents do to their kids, and have a little fun. But the idea to me is trying to help others. When I get called from families and their kids are involved, I will try to talk to the kids to hear what they're saying. But when you can hear genuine fear in their voice because of what they're experiencing, and it's one thing. This is one of the things I'll do. I'll ask, what is it that's frightening you? Well, just seeing them. And I said, but do they do anything? Do they growl at you? Do they show their teeth? Oh, no. They just stare. And I said, okay, well, that's okay. Maybe they're there just to watch you, to protect you while you sleep, so that while you're sleeping and you're in this situation, it's okay. And then they're like, oh, and then it's kind of, I try to take them down those lanes to give them other views that not everything is evil, not everything is dark and malevolent and scary. And I give them those by showing them, when a dog is aggressive, it shows that it's aggressive. And usually that's the way with the paranormal.
Yes.
But, I have a hard time sometimes when they're dealing with things that do look scary and act aggressive. What is the right advice for those children to deal with things? And, you're trying to empower a child. Where do you go with that?
If it is scary and aggressive?
Yes.
Or at any point, yeah, okay. Look, if it's scary and aggressive, I think it's around, all of what we would all do, which is, you can't touch me, leave me alone, providing them with, necessary protective symbols. But it's a little bit like, and I like what you said around snakes in a cave. You wouldn't send children into snakes in a cave. You wouldn't, and we teach children about what we call safe and adventurous versus dangerous and risky. And we get them to kind of understand how their body feels. So, because there's a difference between adventurous fear, like that kind of feeling of being adventurous and risk taking, but not dangerous, versus danger. And so we try and help kids understand how that feels inside their body and to respect that, so that if they're getting those jelly legs and the racy heart, and that they really can't rationalize that this isn't a fearful entity or something to be afraid of, that then they do remove themselves, that they, respect that is fearful, and they get the hell out of there. Whereas I really love what you said about, the alternate explanation. If what they're seeing isn't frightening them, is frightening them, but it's not doing anything to frighten them, providing them with alternate explanations, providing them with skills around mediating the physiological fear response, which is, generally an elevated heart rate, a tightening of muscles in the body. So, I will say to kids, okay, now what I want you to do is I just want you to breathe with me. So, he's staring at you. All right, well, maybe we could have a staring competition with him while we breathe. Could you do some nice big deep breaths and just keep watching? And, maybe, and like you said, maybe it's not something that's nasty. But when it is nasty, I think you have to be, it's like you would with anything. You're not going to say to your kids, oh, look, there's a king cobra, go over and pat it.
Right.
You're going to say, there's a king cobra, get the hell out of there.
Should we teach children to empower themselves and confront, though? Should they get out of my room? You're not welcome here. Should they engage it, or should they ask, is there something you want? What do you need? Should they be working in the sense like a counselor, like you're doing, and trying to counsel these entities?
I would like to think that if we thought that the child had the cognitive capabilities to do that, I would like to think that we would encourage our kids to do that. And if they feel confident enough to, and they're old enough to understand, so, I'm talking, 10, 11, 12, probably above the 10 age bracket. Under 10, kids are still incredibly egocentric, so they're going to react with, this is all about me. They tend to go completely to the bad, the scary. They're the kids that might need mum or dad to come in and say, what do you want? What do you need? Get out. You can't, leave my child alone. But I would like to think that as kids get older, and if we're honouring their experiences, we are teaching them those skills. Yes, absolutely. And that we are saying, what do you want from me? What are you doing here? But I wouldn't have them do that in isolation of a parent in the room, or somebody else, an adult in the room that was, there for safety and security and assurance for the child. That bigger, calmer, stronger, wiser, kinder person, Wouldn't it be lovely? Because, I've been to Waverly Hills. I've had stuff happen that I can't explain. my stepdaughter, when we came back was, that was what really opened up her mind to paranormal. And then, next thing you know, she's off investigating with her dad. And prior to that, she didn't want a bar of it. And I'd like to think that, she has an openness to what might be out there and is prepared to explore that and wonder about that and help if necessary.
Yeah, what always concerns me is when these kids feel cut off from security. They feel cut off from their parents. This thing stands between them and the door, them and the exit point. That's when it starts getting weird to me, because then it does feel like there's something aggressive there that they need to learn to face. But, again, how much do we prepare a child for facing their fears like that?
Yeah, but realistically, the only way you can overcome fear is to face fear. Normally we do it in small staggered doses. If you've got a big looming black entity standing between you and your parents, that's probably a little more complex than, dosing it up in small pieces.
Right.
So, for some of these kids, that then creates a flooding of anxiety and fear. But that's when, you look at alternate strategies around that in terms of, does a parent sleep in the room for a little while? Do you have walkie-talkies so that they can call to their parent to come in and support them if they need to, those sorts of things. I'm not as confident. As I said, Dave, a lot of the kids that I see, I've not had a lot of kids report anything malevolent. In fact, I haven't had any of the kids that I work with report anything malevolent, which is, I find, really interesting.
Mm-hmm.
And I know there's a theory out there around, traumatized people are more open to malevolent spirits. And, I don't know about that. I guess my clinical experience doesn't suggest that so far with kids. My clinical experience suggests that, trauma, while it does heighten sensitivity and it does create an enhanced emotional dysregulation in an individual and therefore possibly make them more open to, paranormal entities, it also makes them more open to that magical fantasy-based thinking. And I can't help but, like I say, not one of the kids I've had has talked about negative entities. And the only experience where there was a hint of a negative entity was a mum who was just shopping for any diagnosis she could get. And when she couldn't get a mental health diagnosis for the child, she then started to talk about, a being in the room that would, lift the kid out of the bed and throw her across the room. And when I interviewed the child, what it was that she was actually getting out and playing. And when she heard mum and dad get up, she would bang herself into the wall and tell mum and dad that the ghost had thrown her across the room so she wouldn't get into trouble.
Oh, okay. Yeah. Oh, kids are sneaky, huh? Anything to get out of trouble. It's a ghost, Mommy. It's a ghost. And I know if my kids heard that, they'd probably go with the same claims. The brain is a funny thing, and we deal with grief and pain and anger and anguish and anxiety in different ways. And it's something that can be tricked so easily into believing in things that are not real. That's where I have a hard time with it is with, there's times I've experiences I can't wrap my head around. And, for me to try to explain to children what's going on or to take their fear away from them when I really have, I'm not seeing through their eyes. I'm not experiencing it, what they're seeing. It leaves me feeling kind of powerless myself, in a way of helping them. And I'm sure there's a lot of people out there that are dealing with the same thing. Their children are experiencing this. It's like that feeling of helplessness when your kid is really sick and all you can do is sit there and watch them vomit and cry, and there's no magic tool. You can't wipe it away and give it a kiss. You just have to let them deal with this issue. That's a really hard part as the adult.
That is an incredibly hard part as an adult, and it's probably one of the hardest tests I think you have as a parent is the the helplessness you feel when you can't fix something for your child, and that you can't make it right and you can't make it better in the moment, and that you have to sit by them in the process, being present and being nurturing and being available and being loving and supportive, and all the while maintaining your anxiety and your fear for them, so that they don't pick that up and so that they don't run with that. And that's that bigger, calmer, kinder, stronger, wiser, perception or persona. You maintain a grounded as best you can. And it is so hard. And it sounds so easy when I say it. And it's not easy. I've been doing this for a long time, and I still fail at it as a parent from time to time. And it's incredibly hard to get, because the reality is emotions are very difficult to mask sometimes. But as adults, when we're helpless to do anything for our children, the best we can do is we can be there for them as best we can in a co-regulatory state. So what that means is that we're regulating our own emotions to be able to regulate theirs. And in the context of that relationship and that presence, you provide your child with security and stability and nurture that goes some way to alleviating the yuck that they're dealing with.
Well, you offer a free consultation service that you run for private investigators and people that are dealing with the paranormal. How can people reach out to you and get this kind of information if they're dealing with their own children, or they're investigators that are going out to homes where children feel like they're at risk?
So I have a Facebook page. This is all relatively new. It sort of started at the end of last year. It's called Alternate Perspective. So Facebook page called Alternate Perspective, and there's a send email button on that, so people can send me an email. Otherwise, they can send me an email, and I can give you that email address later if you want it, or do you want that now?
Go ahead. Yeah, let people know about it now.
Okay. So it's PARACHELLE, Parachelle, at bigpond.com.au.
All right, and people can reach out to you that way if they have questions or concerns in dealing with.
They can throw a post on the Alternate Perspective page, and I will get back to them. With the teams here in Australia that contact me, I set up a webinar. I have a webinar platform that I use for my day job. So I set up a webinar platform, a webinar meeting, and we can discuss it face to face. We can talk about what the children are going through. I can provide some hypotheses and theories, some strategies, some techniques, and send them off on their way and support them through that process. So even doing follow-ups and stuff like that, more than happy to help.
Chelle, there's a lot of people who have children on different medications for different reasons, because it's, especially in the United States, it seems doctors are really willing to dole out medications. And, when I was a kid, I'm sure I would have been diagnosed ADHD or OCD or whatever. I would have had these problems, and I'm sure I would have been doped through the hilt in today's society. Are there any treatments that are currently out there that you're aware of that can cause hallucinatory effect? If my kid is claiming to have this, but I also know my kid's on Ritalin, should I be should I what am I looking to say here? I don't want to say dismiss, but I mean, should I be more willing to believe that it's drug-induced hallucinogenic moments, or is it? Do you believe that there is something to some of these medications opening up abilities?
It's a very good question, Dave, and pharmacology is not my strength. I know that the medication of children in the United States is rampant, and it's on the increase here in Australia. I know that we have a lot of children who are misdiagnosed and then medicated. It's particularly in the trauma field, so it is incredibly easy to mistake trauma symptoms for ADHD, for things like oppositional defiant disorder, for autism spectrum, and therefore children end up medicated. Children who
what did you call that? Oppositional
defiant disorder.
Okay. What is that? I think every one of my kids has that.
Oppositional defiant disorder is essentially, nuts and bolts in a very brief description, is the inability to kind of respect authority, follow rules, poor moral conduct. So the kids that act out, get into trouble at school, don't learn from consequences, things like that.
And what's the best thing for that? Put them in a half-filled bathtub and start throwing them electrical appliances until they learn their place, Chelle? Is that what we should do?
Probably not.
Oh, damn it.
Probably not the best evidence-based practice for oppositional defiant disorder, no.
Oppositional defiant
The reality
disorder.
is for a lot of these kids, and I'll probably get crucified by some people for saying this, and this is purely my professional opinion and from years of clinical experience, is that for a lot of these kids, I have either had horrific trauma experiences and disrupted attachment, so poor relationships. So they haven't had an adult in their world that's been safe and reliable and predictable, and therefore they then need to be in control of their world and all of those sorts of things. But the other part of it is just the how to word it without wanting to sound really nasty. I suppose the shift in parenting. Parenting has become more inconsistent over the years, and I think the advances in technology have contributed to that quite significantly, as has the need for us to have two parents working to survive. The economy has had an impact on our families and the way we parent our children, and therefore the way they behave. So our capacity to be present, available and consistent in discipline and consequence and teaching children has become increasingly limited. We're time poor, so we're more inclined to punish than teach. Discipline is about teaching. The word discipline comes from disciple. Disciple is a student, not a victim. And punishment, because we're time poor, and we're angry and we're full of our own emotions, we throw a punishment out there that's not related to the behaviour, and so I think oppositional defiance kind of, is largely born out of some of those things. But those kids end up on antipsychotics, and that concerns me. We have kids in Australia who are, with diagnoses like that where they're really acting out, and they end up on an antipsychotic called Risperdal, which is an adult antipsychotic. It's not even for the use with children, but because it dampens their symptoms. But then I don't know that medication. I would hope that none of these children are doped up to the point, Dave, that they're having drug-induced hallucinatory experiences. I would hope that, they're taking their Ritalin within the prescribed dose and not like I
know that even caffeine can have hallucinatory effects. I just didn't know if people are, have their children on some different kinds of medications, if there was anything immediately we should watch out for. There's a good chance that this could occur, that type of thing. It's all fascinating, and I hope that people that are having issues with their children in the paranormal certainly take some notice that there are positive ways to handle this, and we shouldn't lead children with yes or no answers that we kind of lead them to. We should leave them open-ended, get the full experience from them, and always, I liked your point, try to remain calm. Even when it sounds terrifying, you remain calm and non-overreactive to it in order to try to help them gain some strength and perspective on this as well.
Absolutely. And you know what? We're not here. I'm a big one for when I work with, as I said earlier, I don't work with my reality. I work with the reality of the person sitting in front of me. And that's when I get my best outcomes. If I try and impose my belief systems on my clients, or if I try and, aside from the fact that it's like phenomenally unethical, if I was to try and work like that, I'm going to be pushing them. I'm going to be shoving them. I'm not going to be standing alongside them in their journey, helping them find the solutions they need to their problems. And I do that with kids as young as 4. What does that feel like? When are times that it feels better? Okay, so how can we get more of those times? And that might involve parents and things like that. But it's, we need to take that child's reality and go, okay, that's what you're experiencing. Tell me about that. What's that like for you? How can I help you with that? What do you need from me?
All right. Well, Chelle, thank you so much for joining us this evening and discussing this. It's important, and I'm glad that people have a resource like you out there. Tomorrow, we're back. Bill Burns, our guest, War of the Worlds, the 75th anniversary of the Battle of L.A. We'll discuss that, UFOs, alien intervention, and more tomorrow on Beyond the Darkness.